Hi, I'm Pam Sass. I'm a family doctor in Brooklyn, and I'm a member of PNHP, which is Physicians for a National Health Program.
And I'm Oliver Fein. I'm the local chapter chair for the Metro New York Physicians for a National Health Program.
Great. So could you tell me a little bit about, I guess, first of all, the bill that is in the House?
Yes, there is H.R. 676 that was introduced by Representative Conyers, who's from Detroit. And that bill is essentially a bill to take Medicare, the program that's largely for the elderly now, expand it so that it would cover all Americans, and improve it so that, in fact, some of the deductibles, co-insurances, and limitations in the program are addressed. And that's what we call H.R. 676. It was introduced by Representative Conyers, and we now have 77 sponsors, co-sponsors, in the House of Representatives.
So how would this be paid for?
Well, frankly, we see this moving towards a system whereby we wouldn't have to have many different insurance companies covering health care. If we did that, we calculate that there would be over $300 billion saved by having a more efficient administration within the system, without having dollars go to shareholders in for-profit companies. And we would be able, in fact, to redirect that money so that it would cover all the uninsured and underinsured in the United States. So it's a real wonderful program in some ways because it wouldn't increase our overall health expenditures, but be able to get everybody covered.
And I see that we're asking people to sign this petition. Do you know what?
Yes, this is a petition that we are having people sign from all over the United States. We actually had a group at the Atlantic Antic earlier this fall, and these petitions will go to Representative Conyers to indicate the level of support for this activity among the public.
Are physicians really interested in this?
Physicians, yes, but I can't say that a majority of physicians favor this at this point. One of the interesting things is that our organization, Physicians for a National Health Program, has approximately 14,000 physicians in it, but of course that's very small in relation to the total number of physicians in the country. However, an increasing number of physicians, such as those in the Academy for Family Practice, physicians who are in the American College of Physicians, people who are in the American Academy of Pediatrics, are increasingly in favor of a national health insurance program in the United States. At this juncture, I think it's only the AMA that is opposed, but they only represent 27% of all physicians in the United States. So we're optimistic that, in fact, more physicians will come out in favor of a national health insurance program.
Are you seeing any tendency toward business being supportive of a health program?
Yes, I think that there was a survey done by CFO magazine. That's the Chief Financial Officer magazine. 249 respondents, 32% of them favored a single-payer national health insurance program. That word single-payer is frequently confusing to people, but what it means is a program like Medicare. Medicare is our single-payer program in the United States. And I was really surprised that 32% of CFOs, Chief Financial Officers, favor that kind of program. There were 45% who opposed it, but that means that there could be a majority of CFOs that favor a national health insurance program.
Okay, so why did you stop here? Why are you for this?
I'm self-employed, and so I pay $283 a month for health insurance, which is a lot of money. And I have good health insurance. insurance, I'm lucky. I've been able to do it through the freelancers union, and it's good health insurance, but it's still a lot of money. And for a while, I didn't have any health insurance, and it was scary. I got sick a couple of times, and it was a lot of money to take care of myself. So I think that with the changing, having your healthcare tied to your employer when most Americans change jobs and have no longer don't have these traditional careers anymore, it's unrealistic to expect employers to pay for care, especially with the growing costs. It's not really feasible for a lot of small and medium-sized businesses to do. So that's why.
Hi, I'm Dr. Barbie Gatton. I'm an emergency room physician in the Bronx, and I'm a member of Physicians for a National Health Program. I'm a member because it is so important for the health of our community, of every community in this country, that everybody be able to see a doctor and not come to me in the emergency room for their care. We spend more money on healthcare than any other country and get less for it. And we need to fix that. And the best way to fix that is to guarantee that every single person in this country can see a doctor and not have to have a yard sale for healthcare costs, not have to declare bankruptcy for medical bills. We need to take care of our own, and the best way to do that is to prevent disease, to get everyone in to see a doctor early and not wait until the last minute. So, and the best way to do that is to have a program where we have Medicare for all, every single person.
Right. And could you tell me again, why is single payer important? What is it about single payer that would make a difference?
Well, largely it's the most efficient way to deliver health care in the United States. Because you don't have, the 1,000 or so different insurance companies, and you have a single, in essence, government payer in this instance. You don't have the overhead costs that come with multiple payers, and those overhead costs can amount to 30% of all the premium dollars that an insurance company cannot collect, which means that only 70% of those dollars goes to doctors and hospitals. With the Medicare program, only 3% stays for the bureaucracy of the program. 97% of the dollars actually go to doctors and hospitals. So it's a very efficient way of reorganizing the healthcare system.
Thank you.